Good evening, everyone. My name is Sarah Gordon. I am here to talk about my supervision professional disclosure statement and share a little bit with you all about my competency, training, certifications, approach, style, some of the expectations for myself and the supervisee in supervision, and some of the responses if there are concerns during this relationship. So I want to start with my educational background. I have a Master's of Science in Clinical Counseling and Mental Health through the University of Phoenix. This is a K-12 program, and it was a very positive experience for me as I developed from a case manager within the behavioral health system and progressed to gaining counseling skills and being a licensed professional counselor, which I currently am in the state of Arizona. I'm also currently attending Walden University. I am completing coursework towards my doctorate in counselor education and supervision with a specialty in trauma and crisis. And as far as certification, so I am a certified clinical trauma specialist. I also hold a certification in the neurosequential model of therapeutics. Both of these are trauma-based, and I'll talk a little bit about trauma-informed care as part of my approach as we continue tonight. My training background, so I have completed trainings in EMDR, cognitive processing, trauma-focused cognitive behavioral therapy, crisis intervention, nonviolent crisis intervention, heart math, and various other supervision, counseling skills, micro skills, and various other annual trainings that are part of work within community mental health. As far as competence and preferred population, so I currently work with adults in a federally funded community health center. This is an integrated model of care, and in my program, we serve individuals, adults who are currently HIV positive or have AIDS, and we provide individual counseling or couples counseling sometimes. My previous experience was at a nonprofit here in Southern Arizona in Tucson, and the population I worked primarily with was children or adults who are survivors of childhood sexual abuse. My preference, as I mentioned before, is trauma-informed care. I also have experience working with the Department of Child Safety and the state foster care system. Presenting concerns that I commonly worked with are anxiety, depression, post-traumatic stress disorder, some experience with personality disorders, but I would defer to colleagues and consult for more information on those. And developmental trauma, early childhood trauma, neglect, physical and sexual abuse, domestic violence, divorce. All of these areas of focus where I provided counseling either individually with couples or with families. As I mentioned, 12 years at the nonprofit where we provided counseling to low-income families, children, adults. And most recently, the past 3 to 4 months at the federally funded Community Mental Health Center. I also volunteer in the community. I try to maintain involvement with online trainings, forums, and continuing to learn about new approaches, evidence-based approaches, and connecting with other professional counselors. I want to talk a little bit about the supervisees that I would work with. And so currently I am completing the state-based requirements for clinical supervision in the state of Arizona. This requires me to complete a training course, 12 hours of education on clinical supervision, and then submit paperwork to the Board of Behavioral Health. So currently I am open to providing supervision to students within Walden University's practicum programs, the graduate master's level counseling program. And upon completion of the training and education requirements for the state of Arizona, I will open up supervision services to master's level students within the state of Arizona in their graduate programs, and non-independently licensed counselors in this state who are working towards licensure and need hours from a licensed professional counselor. As far as my philosophy and approach to supervision, it is developmental, cognitive, reflective, and relational. There are two very specific goals of supervision in my mind, and those are development of your counseling skills and protection of the clients and the families and the community that we work with, that we have the honor of working with. The integrated developmental approach to supervision would allow me to support you in building confidence as far as assessment, being able to conceptualize your client's needs and functioning, understanding theory, counseling theory and approach, organizing your approach to your clients, understanding, comprehending, and using ethical and professional behaviors in your counseling efforts, and establishing your identity as a counselor. The cognitive influence in the integrated model of supervision would allow me to support you in reflection regarding thoughts, feelings, behaviors, actions on your part, setting agendas for our supervision meetings, and connecting our supervision meetings through homework assignments between sessions to build on skills, build on whatever our focus was on the previous week. Finally, the relational component of my approach to supervision and my style would be addressing interpersonal, intrapersonal skills, recognizing diversity, recognizing cultural differences, not only between yourself and I, but between the clients and families and yourself and the community that we work with, and embracing those differences to meet their needs and protect them. The supervision process. So the supervision process, we will begin by exploring your strengths. My counseling approach is solution focused and strengths based, and so we will look at areas where your creativity shines and you are successful in your approach, and build on those at your current developmental level, meeting your needs in each of the situations that you bring to supervision, so that we can provide appropriate counseling services for your clients. We will meet for 1 hour per week. My goal is to create a safe and supportive space for you to reflect on your experiences, to gain those skills, to have these conversations, and to continue to highlight your strengths and areas of competency as we progress. It is a collaborative experience. We are working together. In working together, I will employ the roles of teacher, consultant, counselor, mentor, and evaluator, depending on the focus of each of our supervision sessions. As far as expectations, so anxiety within the supervision process is typical, it's expected, and usually what we see is it decreases as we continue to meet, we have some trust and rapport, and you are able to practice and implement and reflect upon your skills. I personally experienced that anxiety when I was entering the practicum components of my graduate coursework, and hopefully we can have some open conversations about how that influences your approach and practice and how things are going for you. Each week I would like for both of us to be intentional and be prepared. I will prepare resources depending on the role for your needs each week based on discussions that we have, and I would hope that you would bring information regarding your sessions to our meetings so that we can further discuss, we can identify the approach, modality, interventions that might be helpful within your lens and your approach and meet the needs of your clients. For myself, I have some personal expectations to be consistent with you, to be available within reason. There is emergency contact information within the disclosure statement that you can use if I am not available. And so I would hope that you can reach out and ask any questions between supervision sessions, and I will respond to you as quickly as I can. I also expect that we have signed releases from your clients confirming that they are in agreement to you being supervised, and that protects their rights to confidentiality. As far as evaluation for you and I will set some goals at the onset of our relationship, and we will work on those goals each week. We will discuss how progress is on those goals and identify ways to improve progress. And we will adjust the goals as we need to. I will offer constructive and supportive feedback, and I will help you process some of the feedback, especially if it's constructive and it is more difficult to hear. As far as any remediation concerns, any concerns as far as impairment, we will discuss the evaluation process, the assessments that are used for both my evaluation of your skills and also your assessment of how you believe supervision is going. And so, like I said, this is a collaborative, mutually beneficial relationship. We will work together. We will offer each other feedback, and I will attempt to maintain the professional competency and behaviors that I have outlined in my disclosure statement, and continue to seek education, weekly peer consultation, and supervision in group settings for myself, and expect that you are able to come to sessions and openly discuss what is happening for you, and we can progress in our work together and offer the feedback to the program that is part of your supervision contract. At the end of the disclosure statement, there are resources for the state board. There are contact information, phone number, email for my supervisor currently. And all of this information we can further discuss when we meet. All right, thank you.